So welcome to Pregnancy and Fertility and the COVID-19 Vaccine, an African-American community conversation. Our purpose today is to really make sure that our community and our partners have access to evidence-based information about pregnancy and the COVID-19 vaccine. We want to make sure that we are providing a space to make sure that we are addressing misinformation and just continuously reinforcing the effectiveness and safety of the COVID vaccine. So without further delay, we're going to get started. I just want to remind everyone that this is being recorded. The chat will be monitored for questions. So if you do have questions, please feel free to put your questions in the chat, and we will have an opportunity for Q&A at the end of our presentation from our panelists. And I'd like to start by introducing our panelists today. Dr. Gwen Allen is with us, and Dr. Gwen Allen is an OBGYN, and she completed her medical training in Los Angeles. She is experienced, and she specializes in high-risk pregnancies. She's affiliated with several hospitals in Los Angeles, and so she will be sharing with us today what she has seen in the clinic setting, in the hospital setting, and also a little more about what's going on with women who are pregnant and unvaccinated, and what we know about the benefits of being vaccinated during pregnancy. Our second panelist is Jada. Jada Chattery, and she's a maternal child health registered nurse. She is a graduate of Louisiana State University, and she calls herself a badass rock mom who was born and raised in Louisiana, currently residing in LA. And really her time, commitment, and passion has been dedicated to addressing Black maternal health. So we're very excited to have our two panelists today, and it will be a very lively and engaging discussion, and we are excited to have both of you. So with that, I'd like to start with Dr. Gwen Allen.
Good morning. Thank you, Shantae and the Vaccinate All 58 team for having me here this morning. I come to you with, just excitement so we can have an opportunity to have full disclosure and conversation about what's going on in our communities with, people of color. As you stated before, I'm Dr. Gwen Allen. I'm a board certified OBGYN in Los Angeles, California. I've been practicing now for over 23 years. Here in LA. I was born and raised here in actually Compton, California. So this is my passion, to come back and to help and to treat and to educate. And this is a great forum to do so, and to have women to take a look and listen to people of color so we can understand that this is not something that's coming from the government. It's coming from people who look like you, speak like you, and want to survive like you. So again, thank you. And it's a pleasure to be here today. And I just want to say that all the vaccinated team, I'm glad that you have this forum for us. With all that being said, this comes at a great time, because even though people are relaxing and stating that, oh my God, COVID-19 is over, I'm fully vaccinated, let's take off my mask, let's just go out there and, and continue to live a life. But however, pregnant women are shying away from the vaccine. They're shying away from the fact that they need to be vaccinated. They're not looking at the fact that there's another life inside of them. The vaccination is safe. If we take a look at the community in Los Angeles, California, Los Angeles County alone, there have been over 12,000 women in this county that have tested positive for the disease. And out of those 12,000 women, 12 of them have died. And 62 of those infants have been tested positive for the virus. These numbers, as stated before, they're really jarring, and we cannot let our guards down. And that's why we want to say, and this form is good, you should be vaccinated. There's the fear. We're here today to take the fear out of that, to say, let's get vaccinated. Let's save our babies. Let's save our people. And let's try to make sure that we are here for longevity purposes and dispel all the myths that are out there. And, I can go forever, so you can cut me off at any time, Shantae. I just want to make sure that I wanted to put that out to you, that I'm glad that you guys came today with this form so we can talk about it.
Thank you so much, Dr. Allen. No, we really appreciate you sharing that data with us. I want to also to just take a moment to thank our community. Folks have really been coming together, right, to practice harm reduction activities. And I think that you mentioned something really critical, which is when we think in terms of pregnancy, there's a layer, right, of remembering that we're actually talking about more than one life. And so we know that mothers will do anything, right, to protect their children. And we really want to just provide this opportunity to really make sure that folks understand the safety and the effectiveness. So thank you for sharing that data. Those are lives lost, that, potentially preventable lives lost, that through vaccination, the outcomes would have been different. And so our goal really is to make sure that we are preventing deaths from happening from COVID-19 and from being unvaccinated. So thank you very much for what you shared. And Jada, we would love to hear from you. I know that in addition to considering pregnancy and fertility with the vaccine, I know folks have also had some specific concerns as it relates to breastfeeding and lactating moms. And you do have the highest designation and training. And if you can just talk a little bit about your training as an IBC, I like to call it. I know folks call it different things, but if you want to go over what that long acronym stands for and your background, and maybe just talk a little bit about lactating moms. And then we do have some questions as well that we'll get into.
Okay, that sounds great. Well, first of all, thanks again and for having me here. And it's such an honor to share space with one of my very first mentors, Dr. Allen, who taught me everything I know, most importantly, which is to stand firm and advocate for the patient, follow the policy, and be sure to document it. So for all of you aspiring nurses, midwives, and physicians in training, I highly recommend, if you can, cross paths with Dr. Allen in order to be able to gather this information. So then we can all be able to be speaking the same standardized language. My background is maternal child health. I also have a background as an infection preventionist, and I'm a board certified lactation consultant. So where I stand with the vaccine is I do recommend it. Myself and my family members have received the vaccine. I work with patients at the bedside and I answer these questions, a lot of common questions, very, very similar. When you're in the midst of a pandemic, right? No one in our generation has ever really experienced a pandemic. We had a bit of a scare with the Ebola pandemic that came close to our borders and did infiltrate a bit here in the United States. But as far as having a global pandemic of this sort, we have never experienced this. And so I just really try to practice giving space to what is reality and what is a natural response, which is fear of the unknown and concern for not just yourself, but in this case, we're talking about unborn children and very young children, school-age children who do not yet have access to the vaccine. And I firmly believe in evidence-based medicine. I myself and I don't know if you recognize, but I too am human. And so I had some of the same concerns. And I will tell you that, this time last year, there was a lot of misinformation. There was a lot of very intentional fear tactics that were that infiltrated our community. And when I recognized what was happening as far as the misinformation, I myself had to take a hard pause on receiving information from all places. And I took about 2 weeks to just pause without any information from social media. And I went directly to my journals in order to identify what information has been done on the vaccine up to date, become even more immersed and familiar with coronaviruses, because we are familiar with SARS and other coronaviruses, and just really becoming familiar with respiratory viruses and what that means for the right now and how to mitigate those things, which is through PPE, which would be, in our case, masking, and ensuring that we have a proper standard of process for hand hygiening on a regular basis and keeping your environment clean. Also making intentional choices to either not be around people that were showing respiratory signs and symptoms, regardless if they were allergies. I'm in LA, so people will often say like, oh, it's my allergies. And what we know is, generally those first signs of allergies are usually directly linked to being infected with the virus. So, being mindful of the things that are going on around us and making a decision that we can live with, not just for now, but that we can grow old with. So your lungs, as African-American people, we are at a higher risk for respiratory diseases. We have currently in our culture lots of asthma, and we also have things that are not necessarily in our control. And we're talking about our diets and having access to clean water. Those are all things that contribute in our environment to having lung and respiratory concerns. And so because I understood that, I had to go with what I saw and what I understood to be evidence-based, which is to get the vaccine, right? Part of getting the vaccine meant that, I was going to have a day off from work. So that was a perk in order to be able to monitor my signs and symptoms of any side effects of the vaccine, which are common with any medication that we take. So when I am talking to pregnant persons, I am encouraging them to, get the vaccine, ask questions, but then also understand what is reasonable. It is reasonable for your arm to hurt where you receive the vaccine. It is reasonable for you to maybe feel more exhausted following the vaccine. And it's also reasonable for you to have some mild signs and symptoms like a low-grade fever, maybe even chills, and be very, very tired. Hearing those things and preparing for them is very scary. And that is understandable because nobody likes to be sick. But I had to take a good hard look and decide on if I wanted to be sick for a few days or maybe 24 hours. I think most of those symptoms go away after 48 hours, or if I wanted to not be present for my child. And I think that was what led me and my family to receive the vaccine, and what has me here as an advocate for receiving the COVID vaccine, as well as your flu vaccine. And I'm actually an advocate for vaccinations. So I don't like to make people feel shame for their decisions, but really to be able to create space to answer and really just kind of like talk through some of these questions and misinformation. Let's unravel these things in order to try to make sense out of them. So I think that when you are breastfeeding your baby or providing human milk from yourself to your child, then we know that you are passing traces of that immunity to your baby, and that is good for them, and it's also good for you as well.
Jada, thank you so much for that comprehensive overview, and really a perfect segue into just sort of digging deeper, as you mentioned, and peeling back some of the layers so that we can really have a deeper conversation and discussion around some of the misinformation, and then cover also the facts and the science and the evidence about what we know. We heard from Dr. Allen earlier as it specifically related to some of the deaths that had occurred in pregnant women. We know that recently also CDC released a new report which reported that 161 women, pregnant persons, have died in the US who were not vaccinated from COVID-19 infection. And so with that, why don't we just get started with our first question that really comes up a lot at the community level regarding pregnancy, or folks who want to become pregnant, right? So can we hear a little bit about what evidence do we specifically know as it relates to pregnant persons and safety? Was the vaccine tested on pregnant persons, right? So when we say that the vaccine is safe and effective, how do we know that the vaccine is safe and effective for pregnant persons? Dr. Allen, why don't we start with you, and then we'll hear from Jada.
I'm glad you asked that question, because that's what I hear the majority of time in my practice. Is the vaccine safe? How do you know it's safe? How do you know that it's not going to affect my child? One of the things that we do know that the CDC has had multiple testing sites that have tested on pregnant women, and they have not had any adverse side effects. As stated before, like Jada, most of the time that people will feel is the soreness of their arm, the flu-like symptoms, but there's no evidence that has come out of our CDC or all from our organization with the American College of Obstetric Gynecology that indicates that the vaccine will cause early pregnancy loss, will cause birth defects, will cause autism, any things of that nature. So the fear that people have is that this vaccine will have something to do with my child, that I may lose my child. It may cause infertility and things that may, and that is absolutely not true. That is another fear factor or stall tactic that people are putting in the communities of color so we will not get vaccinated. So I say to all my pregnant women, if you can be vaccinated, there's no loss for your child. There is no test that is going to come out that your baby's going to get Down syndrome or autism and things of that nature. That's a fear factor. So I recommend when people come to my practice, when they're trying to conceive, should I take the vaccine? Yeah, it's most definitely important for you to take the vaccine, because if you're not around to conceive, that's a problem in itself right there. Secondly, if you are pregnant, and if you come in contact with someone who has the virus, the symptoms that pregnant women have when they have a COVID virus is 9 times worse than the average person. Because as we stated before, you're taking care of 2 individuals, not just one. So those respiratory problems that Jada spoke about early has escalated to an amplitude that sometimes is too difficult for us to even treat. When you come into the hospitals, a lot of times you come a little too late and you say, why can't you do something for me now? Give me monoclonal antibodies and things of that nature. But the first step to preventing all of this is getting the vaccine, and it's safe. You asked me, what trimester shall I take the vaccine? The vaccine is safe in all trimesters. It does not duplicate. One of the things that we talk about in obstetrics and gynecology is there are certain certain vaccines that we do not give. Those are the live viruses. Most of the viruses that we give, like when you take the flu vaccines, you do the MMR, the rubella, all those kind of things, they are live attenuated virus, meaning that They're virus there, but they cause an immune response, but they are not infectious. And that's what people need to understand. We're not injecting you with an virus so you can go out and become sick. We're injecting you with an mRNA that makes your body look at it. Basically, it's looking at it, saying that this is something foreign to the body. Now let's express something to take care of this just in case you get exposed again. So let's, dispel that myth that no, we are not injecting you with the virus. Number one. Number two, is the vaccine safe? Yes, it is safe. It's safe in any trimester of the pregnancy. Number three, will it harm my child, my unborn child? No, it will not cause birth defects. It will not cause autism. Number four, I think I'm on four. Yes, number four. Will it cause infertility? No, it will not cause infertility. A vaccine does not cause infertility. It does not destroy your eggs. You are born with the same amount of eggs that you have. As you get older, those eggs decline and depreciate. That's a known scientific fact. It has nothing to do with the vaccine. And so when people ask me, how does it cause infertility? I was like, the virus doesn't replicate in your eggs. It does not duplicate in your eggs. You are mounting an immune system. So it's best, I'm glad, again, I can't express the need for this form to put it out there. You cannot become infertile. You can always bear children, and the vaccine is safe at any trimester during the pregnancy.
I think, Dr. Allen, I think that's so good to break down, the real science part of that, because from what I can see from the community side and caring for patients like that, those are the questions that even as you try to answer with evidence, we recognize, and this is for, the Department of Education, you recognize where that gap in understanding for basic biological science is, right? So I always, recommend it's a good opportunity to go back and pull up some of those biology books. Like if you got kids at the house and they're in elementary and middle school, like bring it up, because it's really understanding DNA, RNA, mRNA. I mean, like really the basics of what we're discussing are things that we have built upon and in our educational system should have been building upon since elementary school. And so the questions that lead to fear, we know that when we have fear is because we don't understand. So we can't make a decision. I had someone ask, because, I always ask, well, what's do you want the COVID vaccine? Would you like the COVID vaccine? Would you like the flu vaccine? And if they say no, I always want to know, well, can you tell me what your reason why is? Okay. Now, some of our lovely people, can go real full neck on me and be like, cause I don't want to. Okay. And I'm here for it, right? Because I do believe that you have the choice to make a decision about what goes into your body. However, I also understand that there's not a lot of Black nurses at the bedside that's engaging you and asking you about your choices in order to expand that conversation and dialogue for us to be able to actually walk away with a good, informed decision, right? So when patients will say things to me like, I'm doing my research, right? I will follow that with, that's really good to hear. That's amazing. Well, what are you finding? And then they will share what they're finding. And then I will pivot the conversation because I genuinely want to know, what did you have for dinner last night? Right? And the answer is, Jack in the Box, Subway. That's okay, cool. Did you do a little bit of research on where that tuna came from the Subway sandwich that you enjoyed, right? Because the point is to, if we're going to be investigating everything that we place into our bodies, then let's do it. I'm all for it, right? I've been doing that for a long time now. I'm happy to hear other people are doing that as well. But when your life is on the line, we want to really take a pause and say, okay, who can I engage that I trust, right? And I had someone say to me, a family member say, but I can't trust nobody. And unfortunately, that is the real that we as Black people in healthcare really don't feel like we can trust anyone in order to gather information. And we're not even sure what is true because we have not really grasped the foundation of DNA, RNA, and mRNA. I mean, and that's deep. And it's like, okay, well, Jada, then what are you saying? Well, what I'm saying is that you got to make a friend. You have to go to your provider, identify someone that either looks like you, speaks the same language as you, and can understand where you are coming from so that they can spend 15 to 20 minutes of the time, even if you don't have anything wrong, to spend that time with you, educating you so that you can build a foundation where you can have trust in your healthcare. Because I'm going to tell you, the saddest thing is to have a postpartum female parent who has just delivered a baby wait until their partner leaves to ask you for the vaccine. Okay. And then when you return with the vaccine and their partner is present, they no longer want it. So someone asked in the question, what are some of the common reasons for pregnant women not taking the vaccine? And I will say to you that I have been blown away the number of times that scenario has occurred, right? Where I have women that are making decisions for themselves, but when their male partners arrive, they no longer want to follow through with that. That's not my business, okay? I cannot manage that. But what I can be is a resource in order to deep dive so that they can together be able to make a decision where then the female patient doesn't feel that she is too afraid to even make a good decision for herself, right? I mean, that just opens up a whole nother can of everything. The other sad thing is to deliver a baby in order to deliver a preterm baby in order for the mother to be intubated. Mm-hmm. Okay. And those are the numbers we do not have. We do not have the numbers that communicate how many children are left without one or both of their parents. And I can tell you that when that data does show up, we are going to be blown away by the decisions that we have made during this unprecedented time in the midst of this ongoing pandemic.
And I would like to speak on that again too, and that's some of the things. I wish we can go to something like Scared Straight. What we don't see is that people talking to us, we're on the inside. And so we can see pregnant mothers intubated, babies not surviving, mothers are not surviving, fathers are out there complaining, and the families are complaining because they cannot see their loved ones. We're not being proactive. If you want to see this unborn child healthy, be proactive. Make sure you take your vaccine. The hardest things, like you said, for me, what we had to see is some of my colleagues, because we're obstetrician gynecologists, we have to take you at all means. For me, it was one of my colleagues could no longer work. She had fibrotic lungs because of the simple fact that the patients did not take the vaccine and they came up with COVID. And so now we're seeing 20 and 30 patients a day, COVID positive. And now the physician can no longer practice, can no longer take them because now they have COVID and their lungs are destroyed and you destroyed their career. So when you make a decision of not being vaccinated, you got to take into consideration the community that you are destroying around you. Like you said, bring somebody into trust. You say you trust me, but you don't take the vaccine, but you're killing me. You're killing your unborn child. We see it all the time. People come to labor and delivery. Why can't my mother come? Your mother's not vaccinated. So we cannot take the risk of letting your mother into this particular hospital to expose the newborn child to something that they cannot handle. If you take the vaccine will give some immunity to the unborn child, not a lot, but enough to make sure the symptoms are not so severe that you will not lose that child. Nothing is more devastating to see when we have to intubate and take a baby prematurely. The statistical data does indicate that when you have COVID, there's at least 40% increase in preterm delivery. That's before the age of 34. And then after 37, maybe for 37 weeks, that's late prematurity. And the rate continues to climb. when we talk about that, not only do we talk about the fact that the babies come out prematurely, but now longevity, you're affecting a race of people because infants who are premature are slow to develop, mentally retarded. There's a lot of things that go along with that. So this vaccine is not only having a problem in the here and now, it's going to affect us later on down the line. And then as a people, we're going to say, well, we didn't get the vaccine, or this is what has happened. No, we are doing it to ourselves, and we have to be cognizant of what we are doing to ourselves. I am a Black female. I sit here every day and I counsel people on taking the vaccine. You take the vaccine for the people that are around you. You take it for your 90-year-old mother. You take it for your kids. You take it for them to go to school. And like you said, when you talk to them, why don't you take the vaccine? They go back to Tuskegee. If you ask people of color, what is the Tuskegee experiment? 90% of the people don't even know what they're talking about, but they jumped on a bandwagon to say that, oh, because they vaccinated Black people unfairly, or they didn't treat Black people because it was unfairly done. But at that time period, we got to think about what the time frame was at. We did not have organizations to control how people were being in studies. Right now, there's study that's going on. You cannot say this vaccine is out there killing Black folks when it's in every CVS across the country. It's in every community across the country. So they're not targeting Black folks. We don't say anything when they made marijuana legal and you sit up there and you're not worried about the consequences of what's going to happen to your child. The consequences of marijuana, which is a gateway drug, can cause more developmental delays, all these things going on, but we're not asking about that. We're asking about why I cannot take the vaccine because it's going to harm my child, but you can smoke marijuana because it's going to help with your nausea. So people, I need for you to get on board to make sure that you understand that we are talking about a race of people that we have the ability to control, but we can also wipe that race of people out if we're not well educated and versed on it. I have nothing to gain by giving you a vaccine. The healthcare providers have nothing to gain by giving the vaccine, but making sure that you may remain healthy, that you can breastfeed, that you can be around for your child, that you can procreate without a problem. People don't understand. Men sit there and smoke all this marijuana. Do you know you're decreasing your sperm count every time you smoke marijuana? The cilia, those little things that make it move, are inhibited by smoking marijuana, but you don't want to take a vaccine. That is a proven fact. But you can't stop the man from smoking marijuana. You can't stop the woman from smoking marijuana, but they have these other things about that. I will not take the vaccine because it's a problem. Another thing I just want to point on real quickly is that when you see these mothers and they get COVID, they say, oh, well, my husband had COVID and I had COVID 2 weeks ago and I don't want to take the vaccine. This passive immunity, there's, like you talked about earlier, there's many strains of this virus. We started off, when alpha, now we're in delta. So you got to understand, for those who are Greek, we have a whole slew of alphabets that we have to go to before we get to the end. So they call the Delta variant. Why is it new? Viruses mutate all the time. When it's just like you, when someone is come chasing after you in the community, you change courses. You go down the street, you go down a different street. The virus is doing the same thing. Once they know that we're hip to you, we're trying to get this vaccine on board, now it's going to mutate to a different avenue. So it's not a new virus, it's just a mutant of the same one, because now it is immune to what's going on. So when you come to the office and you say, oh, I had COVID, I'm not going to get it again. Yes, you are, because you're going to get a different strain. Or you're going to come in and say, my family don't need to be vaccinated because, we're covered. I'm covered by the blood. Everybody's covered by the blood. But God also put us in a situation where, I come from South Central Los Angeles. I come from a family that's on AFDC and welfare. So statistical data states that I should not be a physician, but God put me in a place to be a physician to take care of my people. So like you said before, talk to your healthcare providers, get to know them. We're not out here to harm you. We're here to help you. So, I'm sorry, Shantae, go ahead.
No, not at all. This has been a wonderful organic conversation, exactly the way that we intended it to be, right? It is a community conversation. We did not intend for this forum to be filled with clinical jargon, right? Where it would not be meaningful to folks in the community who are watching and listening. Our goal and purpose today really was to have very open, candid conversations about what is happening at the ground level and provide a space to just make sure that we're providing the facts, the data, and the evidence that tells us what is happening at the ground level and what is happening with this vaccine. Several points were brought up by both yourself and Jada. And although you did answer some questions, I would like to be a little more explicit in providing a yes or no to some common questions that come up. I'm going to start with male fertility and also some misinformation specifically around males who are vaccinated. They will develop a fever and then destroy their entire sperm count. So if you could talk specifically about what a fever means and how that relates to any potential illness or cold in someone who is trying to get pregnant. And another thing at the community level, specifically related to our male population, is if a male decides to get vaccinated, that he will experience erectile dysfunction. And so if that can please be addressed explicitly, do vaccines cause dysfunction? And will vaccines kill your sperm count?
I just want to say before Dr. Allen goes down that road that I don't know what's been happening in your hospitals, but it is baby booming season. Okay? It's off the chain, busy. I can't even have a proper break anymore because the babies are popping out so fast. And what I'm seeing is lots of vaccinated parents popping out a lot of babies. I think I had a patient the other day who I had seen it was a little more than a year ago, but it was she was yeah, as soon as I had the baby, then I got the vaccine and then we got pregnant again. So, it is baby booming season. The other thing is that I know that neonatal intensive care units are also off the chain, right? And so I have recently inquired, and maybe this is an opportunity for LA County to look at premature births that are linked to unvaccinated parents so that we can be able to have some data in order to analyze and say, are we seeing this, or am I just assuming that a lot of these unvaccinated patients whose babies are in the NICU, with APGAR scores, meaning that there was something going on immediately following birth with their breathing or their oxygenation levels, which inhibited their coloring, which is what we're looking for in those first 5 minutes, were low, right? And then now the baby's back at the bedside because everything is cool. Well, I know that the patient is unvaccinated, but I also know that there's a swab that's been done. So Dr. Allen, I'm just going to ask you if you can, because I hear this a lot, is I got tested and I was negative. But my grandmother was positive and we all live in the same house and I didn't get COVID.
Yeah. Let me start with that too. One of the things we got to think about is that when someone says, oh, I live in a house with my grandmother and my grandmother tested positive for COVID and I didn't. When we talk about those things, we have to talk about reputable labs. And that's the key point that we need to talk about. Most people will go in and do a swab at the tips of their nose and things like that without going all the way back to what we call the nasal pharynx. You will always get a false negative if you see that you're swabbing in the front part of the nose. So most people will say, oh, I didn't have it. But as soon as you step into the hospital and we put the probe all the way back into your nasal pharynx where the virus can house itself, then you're going to get a positive thing. You're going to say, oh my God, the hospital gave me COVID. No, you were improperly tested in the beginning. And that's some of the things that we need to see. And that's why I also encourage everybody, if you're going out to large venues, they're saying show your vaccine card, show these things, or become negative within the 72 hours prior to going into a venue. As stated before, that you can go on the corner and get a COVID test and show negative, but that doesn't necessarily mean that you're negative because you were probably not properly swabbed. My recommendation is always to use, be vaccinated, and even in large venues, continue to wear your N95. Even if they say that they're vaccinated, because the people next to you may not be properly vaccinated, partially vaccinated, or not vaccinated at all. So you have to protect yourself at all times. Now, going back to the question of infertility in men with the vaccine, with the fever. Anyone who knows anything about medicine, knowing that a fever is a response to your body trying to fight off an illness, doesn't necessarily mean that that's something that's gone wrong. So when you get the vaccine and you have a fever, that's because an immune response is mounting. So your body is like looking for this thing to fight off. Now, will that kill sperm? Absolutely not. Male sperm regroups itself every 72 hours. So unless you have a vaccine every day for 72 hours, no. So the answer to the question is you can take the vaccine. The fever that you get is not high enough. If you're a kid and you have a temperature of 103, 104, where you have what we call cryptoorganism, where the testes is inside the body, that's kill the development of sperm, that's a different story. But we're talking about grown men. No, the vaccine does not cause you to become infertile because it kills your sperm count. No, that is not true. That is not any evidence base out there that can support that drama there. So again, we recommend that you get your vaccine and that it will not cause any harm to you. I'm back on my bandwagon. What will cause harm to you is smoking that marijuana daily, and that will kill your flagella, that will kill the cilia in your sperm. That's why your sperm count is low, not because you took the vaccine, it's because you smoked the marijuana. So people's like, oh my God, I smoke marijuana all the time. But if you look at the males who smoke marijuana and look at their sperm count is actually lower than the individual who does not. So the answer to the question is vaccine does not cause infertility in males or female or decrease the sperm count, and the fever does not cause your sperm to be lower.
Thank you, Dr. Allen. And then lastly, could you address whether or not being vaccinated will cause any issues with functioning? That is something that also continues to be asked at the community level.
Babies are popping.
Yeah. My issue, if you had erectile dysfunction before, you have erectile dysfunction after. The vaccine does not cause erectile dysfunction. It's a totally different mechanism. When we talk about erectile dysfunction, Black men have high blood pressure. So what they do, they don't take their medication for high blood pressure because that causes erectile dysfunction and also decrease in performance. So we have a lot of things that we need to deal with. When we talk about erectile dysfunction, we talk about blood flow to the penis that causes engorgement. Blood pressure medication decrease that flow to the penis to stop the penis from getting an erection. The vaccine does not do that. So the erectile dysfunction is a totally different mechanism. It has nothing to do with the actual vaccine itself. The mRNA, that's the virus, the vaccine that we're giving you do not play any factors to the receptors that's in the blood vessels that go to the spongiosis to the penis. So the answer to your question, that's that technical jargon, but let's do it this way. No erectile dysfunction. If you couldn't get an erection before the vaccine, you won't get an erection after the vaccine. That's a problem that you need to take care of with your healthcare provider. So that's another excuse, guys.
Thank you. Appreciate that. So again, really appreciate the candid conversations. Let's also address some of the more common points of confusion. Just really quickly, 30 seconds or less. Should folks shop around for a specific vaccine if they are pregnant or want to get pregnant? Should they wait for one vaccine over the other?
Oh, let me unmute myself. Oh, no. Whatever vaccine is available in your community, they're all effective. We have Johnson & Johnson, we have Moderna, and we have Pfizer. The difference between the mechanisms, the Pfizer and the Moderna basically have the same mechanism of action. Johnson & Johnson, because it has a one-time shot, is because the mechanism of action is different, but they're all essentially the same. They all have the same effectiveness. So do not shop around, do not wait. Whatever is available in your community, that's what you should take. Currently, Pfizer is having that. We have a booster dose of that. The reason why we have this gap on who gets what is the timing what the research is done. That doesn't mean that the one vaccine is better than the other. We're just saying that there's multiple ways to skin a cat. Just like when you go to the store, you talk to your people about, okay, how many people say, oh, I like Pepsi, I like Coca-Cola, and then some people like Fanta Cola. It's the same thing, but a different brand. So I say that to you again, no, do not wait. What's ever available to you, and it's the same efficacy. So I would suggest to all my pregnant women, whatever available, take it, and you take it at any time frame.
Wonderful. Thank you, Dr. Allen. And Jada, this next question is for you. Again, I want to leave a little bit of time here at the end. So in 30 seconds, if someone is currently breastfeeding, should they get the vaccine while breastfeeding or should they wait?
You should get the vaccine as soon as it is available for you. Right.
And can COVID pass to the baby through breast milk?
COVID is a respiratory virus. So if you are positive with COVID, then you want to mask. Ideally, when you are breastfeeding your baby or preparing your formula for your baby, you want to be masked, right? Because it is a respiratory virus. When you receive the vaccine, then those antibodies that immunity passes through your bloodstream in order to increase your immunity ability to your baby. I would not recommend waiting. I recommend getting the vaccine as soon as you can. And in addition, and Shantae, I know that we're kind of starting to get short on time, but we're talking a lot about COVID vaccine, but I want to make sure that because we're talking about perinatal health care, that it's important to ensure that families are looking at the COVID vaccine in order to protect themselves and their babies for COVID. Flu vaccine, because it is just as important, right? And the Tdap, right? I mean, like, we don't have anyone here from peds, but I know from my experience working with pediatrics, the number of children that get pertussis is sometimes, it can become alarming. And that is the Tdap vaccine that is offered generally during the second trimester, Dr. Allen, for the parent who is pregnant to receive in order to protect their unborn baby from getting pertussis. These are all respiratory viruses that we are trying to decrease and minimize the risk of transmission to babies who are more susceptible to these diseases, and increases their risk for long-term concerns for their respiratory system and or fatalities.
Wonderful, thank you. So before we open up any questions we may have from our media partners, can we please just briefly discuss, I really want to make sure that for folks in the community, for our media partners who are engaging with the community and sharing information with the community, could we just have another word and explanation on why are pregnant women in particular, why are they at a higher risk from becoming severely ill from COVID? Why are pregnant persons in a special high risk category? And also, why are Black women in particular at a high risk?
First, let me address that pregnancy is a vulnerable state as it is. Most of the time when you become pregnant, that's when we find out, that's when you get diabetes, hypertension, and things of that nature. One, because that's the first time that that female comes in contact with the doctor to see everything what's going on with them. Pregnancy also is the fact that your immune system gets a little bit lower, so you're more susceptible to anything, your hay fevers, your colds, everything there. So when now you have a known virus that gets in contact with your body, and your body is always what we call an immunosuppressed state, that's why it's escalated to the nth degree. So when we say to you, it's not, the reason why the focus is so much on COVID at this point is because it's the pandemic. But as an obstetrician gynecologist, we see all diseases escalated in pregnancy, not just COVID. So we're coming to you at this forum today because COVID is at the forefront, but we still have to address the issues of hypertension, diabetes, and asthma, which get progressively worse in pregnancy. So it's not that, again, it's not that they're saying that, oh my God, COVID is much worse. COVID just happens to jump the list because it's a pandemic. Because if COVID wasn't around, we have women who would have gotten affected much worse with flu-like symptoms, much worse with diabetes and things of that nature. So it's just the time in the pandemic that it became more or less of a discussion. But pregnancy is considered high risk in general. And then when we talk, I'm sorry, I didn't mean to cut you off.
No, go ahead. Please expand on pregnancies being considered high risk. I think that's an important point, especially in our Black community.
Right. And then we're in a current study, and one of the things you talked about too is that Black women are a higher risk of getting high blood pressure, pregnancy-induced hypertension, and we're just a category. There's a study that's match for match. If you take an educated Black woman and an educated woman of majority group, match for match, we will have preterm birth, we will have hypertension, and we don't know. There's ongoing studies going on now to say this may be dating back to some things that's going along with slavery back in those days, but we don't really know what the genetic predisposition as of yet that caused us to be at such a high risk. That's why there's a new study also that's going out to say that Black mothers do better with the women of the same color. So Black women, I'm not a plug for me to get more patients because of Black mothers and Black babies, but there is an ongoing study now that states that Black women do better in childbirth when they are delivered by a person of color or a woman of color. So we don't know exactly yet what is causing us to put us as high risk, because match for match, if we do it for education and financial, we are still at a higher risk. So there's more studies that need to be done, but we just encourage Black women to seek care earlier, to do the information for themselves, the research for themselves, and also to talk to your doctors about the fibroid, the hypertension, about not being vaccinated, and so that we can have a better outcome, a perinatal outcome. Because even though we have more money now, we're educated, we're still at the bottom of the barrel when it comes to healthcare and the healthcare disparities.
Thank you. Yeah, thank you, Dr. Allen. I appreciate you bringing that up. I think that's really important. I think we have increasing data and evidence that tells us that there's not a Black gene that causes, like preterm birth, but there is a growing body of research and evidence that demonstrates that chronic stress and racism play a very definite role in the experiences of Black women. And as Dr. Allen mentioned, there's also a lot of data that demonstrates that cultural congruent care, right? Having someone support you that looks like you has shown to be very positive in terms of healthcare experiences. Now, just in terms of looking here at the time, I want to provide just 15 seconds to Jada if you have any closing remarks, and 15 seconds to you, Dr. Allen. We do have a question from the media that I wanted to close this out with. We have discussed it, but I thought it would be good to close out with this last question. So Jada, did you have any closing thoughts or remarks?
Get the vaccine. please wear a mask when you go out in public. Please be mindful of your gatherings that are more than 3 to 5 people. And, you know, let's please take care of our unvaccinated children who are back in school. Please encourage them to wear their mask while they're at school, because the concern about our children who are, you know, to me, our most vulnerable population, they have been very much exposed this school year.
Thank you. Thank you. Dr. Allen?
And I just, again, want to say, get vaccinated. All 3 vaccines are safe in pregnancy, safe in breastfeeding, safe for your fertility factor. Currently, there's no data to suggest that anything out there that you hear about having a baby, not having a baby, about infertility, low sperm count, is not supported. So I recommend vaccinations for everyone.
Thank you so much. And then just really quickly, from Emmanuel Otico, he has a question related to some common reasons. We've talked through that, but if I could ask each of you to close out with what is the single most common reason that pregnant persons are choosing not to get vaccinated, and what is your response? So the one single most factor that is keeping pregnant persons from getting vaccinated, and what is your answer? 10 seconds. Jada, let's start with you.
I think it's lack of understanding and lack of support within their own community.
And your response to that?
Let's unravel the myths. Let's answer your questions. And no, it does not alter your DNA.
Thank you. And Dr. Allen, what is the single biggest factor preventing pregnant persons from getting vaccinated?
The fear is that something is going to happen to my child, that I may have a miscarriage, or my kid may have some type of delay autism. Again, I will just encourage them that read your literature. I'm here to support you. There's no data to support that. And the best thing that you can do for your child is to have a live born child, and that's to be vaccinated.
Thank you so much. I want to thank everyone for joining Vaccinate All 58 today in our community conversations to discuss pregnancy, fertility, and the COVID-19 vaccine, as well as the importance of taking other vaccines as part of your overall health and well-being. We acknowledge and understand that there is misinformation and concerns. And so we really encourage folks to seek out partners, trusted partners who can support them in either identifying or sharing evidence-based information about the vaccine, its benefits, and what we know about the vaccine. We are not out of the woods yet. Please continue to practice social distancing, especially large gatherings in places where you don't know what the vaccine status is of the folks you're engaging with. Please continue to wear face covering, and please seek out information from credible sources so that you have the information that you need to make the best decision for yourself and your family. We want to see a generation of healthy Black babies, and one of the only ways that we can get there is to make sure that we're starting with healthy moms who are vaccinated and babies who have the opportunity to have the best start. So again, we thank you for joining us, and we look forward to seeing you in our next community conversation. Thank you.